Howdy. In this video, I'll walk you through an example of managing a canine patient with diabetic ketoacidosis using a brand new free web-based DKA calculator that simplifies the process. Let's go through our case. Imagine you're treating a 10-year-old, 6.5 kilo male neutered poodle diagnosed with diabetic ketoacidosis. The dog's plasma potassium is 2.9 millimoles per liter, and he has already been rehydrated and is on an insulin CRI for 12 hours. His cardiovascular is stable, and you estimate that his total fluid rate should be around 25 mils per hour. Instead of using the variable rate insulin infusion protocol you normally use, you decide to use a fixed rate insulin infusion protocol for this case. But before I walk you through the fixed rate insulin infusion, let's talk about potassium management for a moment. Since this dog's potassium is low at 2.9 millimoles per liter, one option would be to pause the insulin infusion for 2 to 4 hours until potassium reaches a safer range above 3 to 3.3 millimoles per liter. This would prevent further exacerbation of hypokalemia caused by intracellular potassium shift secondary to insulin infusion. Alternatively, since the dog has already been receiving insulin for the past 12 hours, you could choose to continue the insulin infusion while using more aggressive potassium supplementation and performing frequent potassium rechecks. Now, let's use the online veterinary DKA calculator to create a fixed rate insulin infusion protocol for this case. So you go to veterinary.com and click on DKA calculator fixed rate insulin infusion. First, enter the patient's body weight, which is 6.5 kilograms. Next, let's set up the food bags. For bag 1, I'll use 0.9% NaCl in a 250 ml bag. This bag is designed to deliver a fixed insulin infusion rate of 0.1 units per kilogram per hour when administered at 1 ml per kg per hour. Since our patient weighs 6.5 kilograms, this means bag 1 will run at 6.5 ml per hour unless his blood glucose drops below 125 milligram per deciliter or 7 millimoles per liter. For bag 2, I'll use a 60 cc syringe with sterile water to reduce osmolarity since I'll be adding a large amount of potassium chloride. Alternatively, you could use a different syringe or bag size, such as 250 mils or 500 ml bags, depending on availability, your total fluid rate, and clinical preference. This 60 cc syringe will run 7 ml per hour, which is an empirical rate. The key point is that it should always be lower than the total fluid rate, which is, in this case, 25 ml per hour. As a general guideline for bag 2, I typically choose a rate that's about 25 to 40% of the total fluid rate. And for this patient, that comes out to around 7 ml per hour, which aligns well with this range. Since the plasma phosphate level in our case is high normal, I won't be adding K-phos supplementation at this time. However, this may change, and close monitoring of phosphate levels is essential for all DKA patients as hypophosphatemia and develop during treatment. For potassium supplementation in bag 2, I'll add 0.3 MEQ per kg per hour of KCl to correct the 2.9 millimole per liter potassium level following table 1 recommendations that you can find under the calculator. Now, for bag 3, I'll use lactated ringer solution in a 250 ml bag running at 12 ml per hour with a final dextrose concentration of 5%. To achieve this, I'll add 50% dextrose as my supplementation source. The fluid rate of 12 ml per hour by bag 3 was selected to ensure that the total fluid rate across all bags remains approximately 25 ml per hour as initially determined. This rate accounts for the patient's hydration status, maintenance requirements, and ongoing losses due to polyuria or GI upset. There is also an option to add KCl to bag 3, but in this case, it is not needed based on the patient's current supplementation plan via bag 2. Once everything is entered, I click Calculate to generate full fixed rate insulin infusion protocol. The calculator simplifies the entire process by providing step-by-step recipes, all 3 fluid bags as shown on the screen. Additionally, it generates a convenient table with precise fluid rates for each bag, adjusted according to blood glucose levels, which should be monitored every 1 to 2 hours in patients with diabetic ketoacidosis or hyperosmolar hyperglycemic state. It also calculates the final osmolarity for bag 2 and 3, where electrolytes and dextrose may be added, ensuring safe administration. And finally, my favorite feature, the calculator allows you to print both the bag recipes and the sliding scale protocol with a single click using the print button right here. In this case, both bag 2 and 3 have osmolarities below 650 millismoles per liter, meaning they are safe even for peripheral IV administration. Now, let's go over the key takeaways. The fixed rate insulin infusion protocol can simplify DKA management, making treatment more structured and predictable. Managing potassium levels is critical in DKA patients. Pausing insulin for a short period or increasing potassium supplementation, or both valid strategies depending on the situation. Finally, using a free tool like veterinary DKA calculator helps ensure accurate dosing, proper osmolarity, and a streamlined treatment plan can be easily implemented by the ICU team. If you want to try out the free DKA calculator, head over to veterinary.com and see how it can help improve your clinical workflow. If you want to learn more about intravenous potassium supplementation in dogs and cats, make sure to check out our completely free RACE-approved training program by clicking the link below. And thanks for watching. I'll see you in the next video.